to Dr. Mensch, the radio show that takes a real, compassionate look at mental health from A to Z. Join child and adolescent psychiatrist Dr. Gil Lichtshein each week as we explore topics that matter: autism, ADHD, anxiety, depression, OCD, schizophrenia, behavioral challenges, neurodevelopmental disorders, and more. No stigma, no judgment. Just honest conversations, new therapies, breakthrough treatments, and real solutions for real people. Mental health is not a weakness. It's a treatable medical condition, and help is available. Join the conversation now by calling the studio at 888-994-4995, Studio A. This is Dr. Mensch, where hope and healing begin.
Good afternoon again. This is Dr. Gil Lichtshein, aka Dr. Mensch, here in beautiful Boca Raton, Florida. I'm going to be like Bill and Ted's Excellent Adventure, except we're going to be transporting ahead in time. It's Monday, April 6th, but this is going to be, pretend it's Monday, April 13th. I'm a board-certified child and adolescent psychiatrist in Boca Raton, Florida. My office address, 7100 West Camino Real, Suite 404, and my office number is 561-300-4052, but I'm doing a back-to-back today, so I'm pretending as this is Monday, April 13th, because on Monday, April 13th, at this time, I'll be watching my New York Rangers play the Florida Panthers in a meaningless hockey game, as both hockey teams have been eliminated from the playoffs. Today, I'd like to talk about a topic that I'm actually going to be lecturing on, presenting on a conference in early July in Big Sky, Montana. I'm going to be speaking at a women's health conference, and one of the topics that I'm going to speak on there is discussing common mental health conditions in women. And there are certain, psychiatric illnesses that do, occur more frequently or more commonly in women than in men. And when I talk about, common mental health issues in women, I'm talking about, women starting at when they're childbearing age. So typically like late adolescence and into adulthood, and even, as they get older. I'm not talking necessarily about prepubescent or pre-adolescent, females or girls. One of the, for examples, conditions, major depression. What we do know is, once women hit childbearing age, the prevalence of major depression skyrockets in women to the point where there's about a 2-to-1 ratio women to men, where depression is prevalent twice as much in women than in men. But before puberty, and I don't, in terms of what age that could vary, but let's say, early adolescence, say 12, 13, 14, the prevalence of depression is about 1-to-1. There's about equal amounts of depression in boys and girls, but that ratio changes right at the onset of puberty or adolescence, and that kind of ratio stays prevalent, throughout the life cycle till after menopause, when it kind of reverts back to that close to 1-to-1 ratio. And women may be more prone to certain mental health conditions than men, because think about, again, during puberty or adolescence, what happens is you have major kind of hormonal changes. In women, you have significant changes in presence of estrogen and progesterone, which you don't have to the same degree in men. I'm not saying that men don't have their own hormonal changes, but in women it seems to be having a more of an impact, where it kind of has a more pronounced effect on brain development that can somehow place women, I don't want to use the word more vulnerable, but more prone to developing depression and anxiety disorders. And I'll discuss the three main kind of common mental health conditions in women: major depression or depressive disorders, anxiety disorders, and eating disorders. And again, like eating disorders, for the most part, are much more uncommon in men, except for perhaps something called binge eating disorder, which is the most common eating disorder in men, but still not as prevalent in men as in women. An explanation as to why do these kind of mental health conditions seem to occur more in women than men. One, hormonal factors, the effects on female hormones, estrogen, progesterone, on a developing brain. Two, the unfortunate fact of women certainly, or more likely, or it's clear that they have higher rates of trauma, like intimate partner violence, sexual trauma, than men. And that may very well play a role. Another factor that women deal with, kind of societal expectations. Women often are more considered the caregivers to the family caregivers than the men. There are also, unfortunately today, still economic disparity, gender inequity in terms of, let's say, pay. There still could be gender inequity in terms of where women, or how high women progress, professionally compared to men. Like I remember when I was in med school and residency, and it's probably still some truth to it today, but I remember like orthopedic surgery was considered like a boys' club. And I still think today, for example, in orthopedic surgery residencies, that there's still a higher prevalence of male residents than female residents. So, those are certain, pressures and factors that in issues that women face and men don't. So now talking about the three major health conditions, mental health conditions in women. First is depressive disorders, primarily major depression or major depressive disorder, which major depressive episode is defined as at least 2-week period of time, characterized by depressed mood most of the day, nearly every day. That's different from your usual level of sadness, that causes an impairment in your functioning, and is often accompanied by other symptoms such as crying spells, irritability, changes in appetite, changes of sleep, potentially even suicidal ideation. And then here's the other factor in terms of, we're talking about hormonal influences. You have in women, in a kind of within this major depressive disorder or depressive disorder realm, what's called PMS, or premenstrual dysphoric disorder, and postpartum depression, which men don't have, because men don't go through, menstrual cycle, and men don't give birth to babies, despite some people out there in the world think men can get pregnant, but they really can't get pregnant. And men don't deal with postpartum depression and premenstrual dysphoric disorder. So premenstrual dysphoric disorder is the onset or the presence of depressive-like symptoms that begin about a week or so before a woman's cycle. And that's tied also to changes in progesterone and estrogen levels. Postpartum depression is basically a major depressive episode that occurs, immediately after the birth of a child. And after a woman delivers, there's again major fluctuations in estrogen and progesterone levels that play a role in, making women more vulnerable to the development of these depressive episodes. And so you have in women, again, once they become childbearing age, the prevalence of depression increases significantly to the point where it's a 2-to-1 ratio women to men. You have premenstrual dysphoric disorder. You have even what's called perinatal depression, where women there's increases in depression during pregnancy, and then certainly right after pregnancy. Another vulnerable period of time is what's called like perimenopause. The months to to few years kind of before a woman hits full menopause. It's kind of like another vulnerable period where, again, you're having changes in hormonal levels of, again, estrogen and progesterone it makes this kind of also a vulnerable period where a woman could have had let's say, a depressive episode in the past, maybe while they were pregnant or after they were pregnant, or even if, let's say, they never were pregnant and had a depressive episode, they could have gone years or decades, stable and not have a period of depression. All of a sudden, as they're hitting perimenopause, have another full-blown depressive episode. And again, a lot of it is related to changes in hormones. Once women go through full menopause, the rates of depression in women and men kind of equalize a little bit, kind of to the way it was during, let's say, childhood and early adolescence. So that's one, common mental health condition in women, depressive disorders. So either major depression, perinatal depression, postpartum depression, which are, again, kind of a subset of the bigger, condition called major depressive disorder. Treatment of these of postpartum depression can sometimes get a little bit more, complicated because, in terms of, let's say, using medication, because you also want to be mindful that if a woman is breastfeeding, that you don't want necessarily the medicine to be transmitted in breast milk. If a woman is pregnant and suffers a depressive episode, you got to be mindful of could the medicine potentially be harmful to the developing, infant. So these are certain issues that women also have to deal with that men don't. A 30-year-old male with major depression, I'm not worried about, well, you're pregnant, so I better not use this medicine, maybe consider that medicine. I mean, that's not an issue. But, if a female comes into my office and, is clearly in a major depressive episode, but telling me that they're, 12 weeks pregnant, kind of got to be a little bit careful or cautious in terms of my level of cavalierness in prescribing medicine. The other common mental health condition too that's much more common, again, in women than men is anxiety disorders. Again, that's probably related to, again, the hormonal shifts, because, again, the circuitry of anxiety and depression are kind of very similar. And on that note, I'll take a brief commercial break.
What happens when the mind of a healer crosses over into the darkness of the human soul? From authors David Icovetti, Dr. Gil Lichtshein, and Yolanda DeLuca comes a chilling psychological thriller, Dr. Mensch, A Prescription for Evil. This gripping novel follows a respected Boca Raton psychiatrist who secretly descends into madness, transforming into a modern-day king of the underworld. Inspired by true events and Dr. Gil's childhood connection to a mob family, this story blurs the line between sanity and evil, genius and destruction. Unforgettable, disturbing, impossible to put down. Get your copy today on Amazon.com. Dr. Mensch, A Prescription for Evil, a 2020 psychological crime thriller. You're listening to Dr. Mensch with child and adolescent psychiatrist Dr. Gil Lichtshein. For a copy of his powerful new book, Dr. Mensch's Prescription for Evil, visit Amazon.com. For more information or to schedule a consultation, contact Dr. Gil directly at 561-300-4052 or visit docgil.com. Now, let's get back to the show.
Hello there, Dr. Gil Lichtshein, aka Dr. Mensch, back with you. Started talking about the other common mental health conditions often seen in women, anxiety disorders, and I'm being pretty general with that term. but referring more towards generalized anxiety disorder, which is kind of basically summing up someone with generalized anxiety disorder is like a worrywart, someone who worries about everything and anything. Social anxiety disorder, panic disorder, those are the common, and if you want to lump in also post-traumatic stress disorder, even though in the DSM, PTSD is kind of lumped separately, but I'll for this purpose, I'll include that. And again, why women may be more or have, again, higher prevalence and incidence of anxiety disorders, especially once they hit puberty, again, may be related to, again, the hormonal changes that occur, that are more drastically occurring in women than in men. PTSD more common in women. Again, women are more affected by domestic violence, sexual violence, intimate partner violence than men. Social anxiety disorder may also related to kind of, again, some of the societal expectations placed on women that may not be placed on men. Again, the same thing with anxiety disorders. The sex difference kind of stays pretty consistent, through the lifespan. The good thing about anxiety disorders is that they're very treatable. In terms of, again, some of the concerns in terms of, like, say, medication, especially with women who are either pregnant or breastfeeding. But my take on prescribing a female who's pregnant, let's say with a severe anxiety disorder or a severe depressive disorder, is that the risks of not treating is far greater than any risks of any potential medication. Even it's come to the point where there's been some concern about some antidepressants causing, like, cardiac defects. The American Heart Association, has come out kind of calming some of these worries. I believe the American College of Obstetricians and Gynecology has also said that, prescribing antidepressants in pregnancy should be seriously considered, especially in those women who are severely impacted by either depression or anxiety. And that, we don't have any conclusive data that antidepressants cause serious birth defects or congenital problems, and that what we do know is you have a woman, pregnant female with severe depression, if you let it go untreated, it could potentially, complicate the pregnancy. A woman who's in a severe depressive episode may be more likely not to take care of herself, not take care of her pregnancy, not take care of herself physically and psychologically, and that could compromise, the pregnancy. Obviously, a female, who's not pregnant, is a lot easier to treat than a female who's either pregnant or nursing. Now, the third kind of common mental health condition in women, that this is really where it's kind of more, I'd say specific to women, but certainly a lot, more prevalent in women, are eating disorders. Now, there are a number of eating disorders. If you look in the DSM, but I'm going to focus on the three big ones: anorexia nervosa, bulimia nervosa, and binge eating disorder. There's like an avoidant eating disorder, which is kind of, I don't know, I can't remember the exact term how DSM words it, but it's kind of like there's like an element of like a PTSD like eating disorder. I might even consider obesity as a form of an eating disorder, but in terms of like discussing the most common ones, it's anorexia, bulimia, and binge eating disorder. The first two are significantly, more prevalent in women, like 3, 4, 5, times or even more. binge eating disorder is more of, I believe, like 2 to 1 women. That's the most common eating disorder in men, is binge eating disorder. Anorexia nervosa is very rare in men. Bulimia is rare in men. Anorexia is probably the most difficult, eating disorder to treat, and actually is the psychiatric disorder that has the highest mortality rate among all mental illness. Patients often die from medical complications from not eating. They get, develop electrolyte imbalances, and they'll die from cardiac arrhythmias or go into cardiac arrest or have a seizure. Anorexia is a serious, potentially life-threatening condition, and these patients are often much more resistant to treatment. Often may have to hospitalize them medically. They may have to go into specialized inpatient facilities for treating their eating disorder. Pharmacotherapy comes into play to help with a lot of their comorbid, like anxiety and depression, some of the rigid, inflexible thinking, which kind of almost borders on psychosis. And I have right now in my practice, I have I've never seen this in my experience. I have a 13-year-old boy with severe anorexia nervosa, and he has what's called the restrictive subtype, where he just refuses to eat. But it's gotten to the point where myself, his nutritionist, his pediatrician, his therapist all believe he needs to go inpatient. He's when I sit and listen to talk to him, I can make the argument that he's psychotic. He has these delusional ideas about his eating. Like he'll tell me chocolate is toxic and is dangerous to eat, and I'll ask him I'll just try to gently challenge these thoughts, and he'll just come back to me and say, oh, it's toxic, it's unhealthy for you, and I'll ask him well, where, can you give me some facts? I like to know, where you got this. He's like, no, I just know it's true. He's so ingrained in his ideas and beliefs that he has about his eating that it's hard to kind of get through. So I've actually prescribed him antipsychotic drugs for the purposes of, one of the side effects is it causes an increase in appetite and makes you hungrier and eat more, but also to kind of take away this kind of delusional psychotic thinking he has. Is also very inflexible and rigid, that I'm hoping it can kind of loosen him up. But unfortunately, he's likely needing to go to an inpatient, and it's to the point where his parents may have to go and get a court order because he's so resistant to, he's like, leave me alone, let me do what I want. And I kind of tell him bluntly, well, if we do that, you're going to wind up dead. He's already been hospitalized 3 times in the last couple months because he's had severe hyponatremia, low sodium, low potassium. I've told him, this continues, you're going to go into cardiac arrest and likely die. And he doesn't seem to think that's going to happen. He's like, well, I haven't died, I'm still alive. But it's like, well, thank God, because you wound up being in a hospital. So anorexia is a very, very difficult eating disorder to treat. Bulimia is another, the second most common eating disorder in women. That's characterized by people who go on these eating binges generally, or kind of an oversimplification. But they tend to be a little bit more open to treatment. They have a little bit better insight into their condition. People with bulimia will binge, and then they often will purge. That is the aspect of bulimia that becomes problematic, is when they start purging. They can induce vomiting. They can also develop, dental problems, electrolyte imbalances, and that could also cause some serious, medical problems. But the good thing about at least bulimia is they're a little bit more, or let's say less resistant to treatment, a little bit more insightful and open to treatment recommendations and options. Binge eating disorder is more of people who binge eat, but they don't have the compensatory purging or restricting like people with anorexia or bulimia. And that actually is kind of amenable to pharmacotherapy. There are a number of medications out there that can help with the kind of binging, the kind of like compulsive, impulsive aspects to the binging. So medicines, some of the antidepressants, there's an anticonvulsant called topiramate that reduces appetite, can help with some of the binging behavior, and actually one of the stimulants, it's an amphetamine stimulant called lisdexamphetamine, or branded under the name Vyvanse, that's FDA approved to treat ADHD, is also FDA approved to treat binge eating disorder because it reduces your appetite, and hence you're less hungry, you're less likely to go into these kind of compulsive binge episodes. So at least with binge eating disorder, we have some treatments that, at least pharmacological treatments that have proven to have some efficacy. So at least the outlook, prognosis for binge eating disorder, I would say, is better than bulimia, and certainly better than anorexia. So again, why eating disorders occur more in women, again, probably related to hormonal shifts, but also societal expectations. So I hope that, in this brief little talk, I was able to educate people on, the common, mental health conditions in women. Anxiety and depression are very treatable. Eating disorders become a little bit more challenging, but nonetheless, treatment is the key, to, addressing these three main, big areas in women's health. On that note, this is Dr. Gil Lichtshein, aka Dr. Mensch. I want to wish you all a happy Monday and a good rest of your week. Until next week, have a great rest of your week.
Thank you for joining us for Dr. Mensch with Dr. Gil Lichtshein, helping you navigate the world of mental health with clarity and care. If you or someone you love needs support, you're not alone. Treatment works and recovery is possible. To schedule a consultation or discuss non-medication therapies, personalized treatment plans, or psychiatric care, contact Dr. Gil directly at 561-300-4052 or visit docgil.com. You can catch us each week on South Florida Oldies Radio and streaming across all social platforms. Until next time.